Have you ever gone to a so-called tinnitus specialist and been told that the hearing aid will solve your tinnitus? Then you get that hearing aid only to find out that the ringing didn't go away? I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus here in Utah, and I've been specializing in treating tinnitus for over 20 years. I'm seeing a disturbing trend. Too many clinics claim to treat tinnitus by pushing hearing aids as the one-size-fits-all answer. And I can tell you, if that clinic only offers a hearing aid as the answer to your tinnitus, you're not getting the full picture. Stick with me, because in this video, I'll walk you through the 5 hallmarks of a true tinnitus specialty clinic, so you can finally get the comprehensive help you deserve. All right, so you've gone into the clinic and accepted the evaluation and walked out with the hearing aids and not much else. If that sounds familiar, you're not alone. Here's why this happens. For most people with tinnitus, there is some level of hearing loss. Your brain is used to receiving a full stream of sound. When hearing loss occurs, that stream gets reduced. In response, our brain turns up the internal volume and makes static to make up for what's missing. That's what creates the tinnitus. So yes, it makes sense that if we restore sound with the hearing aid, the brain doesn't need to regenerate as much internal noise, and the tinnitus may become less severe. In fact, a 2007 survey found that 60% of patients reported relief from their hearing aids alone. But here's the critical point that gets missed. Tinnitus is not an ear problem. It's a brain problem. A hearing aid may help during the day when it's in your ear. What happens when stress makes the sound spike, even if the hearing aid's in your ear? This is a story I hear from patients every single week. They spent thousands of dollars on advanced hearing aids and feel a flicker of hope. But the anxiety, the sleepless nights, the frustrations are all still there. They realize they've been sold an expensive Band-Aid for a condition that requires a full strategy. This is the fundamental failure of the device-only model. It treats the sound, but ignores your reaction to the sound. And the reaction is where the real suffering lives. So what's the alternative? What should real tinnitus care look like? A genuine tinnitus specialty clinic runs on a completely different philosophy. It's not about pushing a hearing aid. It's about building a long-term personalized plan. Here are the 5 hallmarks of real tinnitus care. Number 1. Remember, not all audiologists are trained to manage tinnitus. Look for someone with extra credentials, like the CHTM. That means Certificate Holder in Tinnitus Management. This isn't just a weekend seminar. It's advanced training. Think of it this way. If you had a serious heart condition, you wouldn't just go to your family doctor. You'd want a cardiologist. Tinnitus is just as complex. You deserve a specialist. Number 2, and this is where most clinics fall short. A real specialist doesn't just hand you a hearing aid. They have a whole toolbox of therapies, and they will tailor it to you. Here are some of the most powerful tools that they have. Tinnitus retraining therapy. Think of this like reprogramming your brain. It doesn't cover up or mask the sound. It trains your brain to treat tinnitus like the hum of your refrigerator. At first, you'll notice the refrigerator when you get it, but over time, your brain will tune it out. Studies show TRT provides relief in about 80% of patients. Then there's bimodal neuromodulation, or Lenire. This one sounds kind of futuristic, but it is approved by the FDA. It combines sound in your ears with gentle pulses on your tongue. Strange? Yep. Backed by science? Absolutely. Research shows real improvements in tinnitus, especially for people who didn't get relief from hearing aids alone. Then there's progressive tinnitus management, which was born in the VA, where tinnitus is extremely common. It's a step-by-step program that adjusts based on your needs, from education to full-on counseling support. And then there's cognitive behavioral therapy, which might be the most critical piece. You see, tinnitus creates a vicious cycle. The sound causes anxiety, which makes you focus on it more, which makes it louder, which creates more anxiety. Cognitive behavioral therapy helps break that cycle by changing how you respond to the sound. And yes, hearing aids are part of that toolbox, but they're not the whole solution. If you've only ever been offered a hearing aid for your tinnitus, I want to hear your story in the comments. And please, subscribe to our channel, because here you'll find evidence-based strategies, not sales pitches. Okay, the third sign is where cutting-edge care really shines. The best clinics won't just ask, is the tinnitus softer? They'll track it using objective data. One of the best tools we have for objectively measuring things is your heart rate variability, or HRV. It's basically your body's stress meter, and tinnitus loves to crank that meter up. A massive study with over 72,000 people found a lower HRV directly linked to more severe tinnitus. And look, I get it. Nobody brags to their friends. Guess what? My HRV improved this week. But in clinic, this data is gold. It shows us if treatment is actually calming your nervous system instead of just giving you short-term distractions. And number 4, the clinic will realize that tinnitus doesn't exist in a vacuum. It's tied to your stress, your sleep, your diet, and your daily habits. Honestly, sometimes I feel less like an audiologist and more like a detective or a coach. I'll ask patients, how's your sleep? How stressed do you feel? Are you running on a lot of caffeine already today? Because every one of those things can make your tinnitus worse. And yeah, I know what you're thinking. Great, another doctor telling me to sleep better. I get it. Even the phrase sleep hygiene sounds ridiculous, like you're supposed to be flossing in your dreams. But here's the truth. At 2 a.m., when the ringing is screaming at you, sleep really does matter. That's why real specialty clinics give you tools for stress, sleep, diet, and lifestyle. It's not glamorous, but it is empowering. And that empowerment is what helps put you back in control of your tinnitus. And finally, number 5, the best clinics actually make space for tinnitus care. They don't try to squeeze you into a short appointment between 2 hearing aid fittings. They're going to take their time. They listen, they schedule real follow-ups, and they work with a team like ear, nose, and throat doctors, neurologists, and psychologists, because tinnitus is a whole person condition, not just an ear issue. I always tell my patients, if your clinic makes you feel like you're on an assembly line, you're in the wrong place. So let's wrap this up. Tinnitus is not a hearing aid problem. It's a brain problem. If all your clinic offered you is a hearing aid, you're not getting the care you deserve. Look for the true hallmarks of a specialty clinic: advanced credentials like the CHTM, multiple treatment options, objective tracking, a holistic approach to care, and a patient-centered philosophy. If you'd like to learn more about treating your tinnitus, you can find information for free on our online learning center. And if you're here in Utah and ready for real tinnitus care, you can schedule on our website. I'll leave links in the show notes below. Thanks for watching today. And remember, you don't just have to live with your tinnitus.